Hi, so today we'll talk about neonate with constipation and delayed passage of meconium. First of all, what is meconium? Meconium is the first stool that the neonate passes, and if the neonate is passing the first stool after more than 48 hours of life, then it is known as delayed passage of the meconium. Now, there are three differential diagnoses for it. One is Hirschsprung disease, second is cystic fibrosis, and third is congenital hypothyroidism. So, how are you going to differentiate between the three? First, if I'm going to talk about congenital hypothyroidism, it has some additional features because of which you will be inclined to think of the diagnosis, and hence your best step in management will be different. So if we're talking about congenital hypothyroidism, the neonate will present with poor feeding, lethargy, slow and poor weight gain. Okay, and there will be, on physical examination, there will be enlarged fontanelle, there will be a protruding tongue, puffy face, umbilical hernia. Now, why is the fontanelle enlarged in size? That is because of delayed bony maturation. Okay, and why is the tongue? We are talking about a protruding tongue, which is also known as macroglossia. This is due to mucopolysaccharide deposition due to decreased degradation of mucopolysaccharide, and it is associated with umbilical hernia. Now they can also give you a scenario in which they mention you the physical findings of umbilical hernia, congenital umbilical hernia, and then they ask you what is the next best step in management. So basically you do not do any intervention, and that is because usually the umbilical hernia resolves spontaneously till 5 years of age. If it doesn't resolve till 5 years of age, that is when you would consider surgery. Okay, moving on, it is the patient will present with constipation, okay, and that is due to decreased gut motility, prolonged jaundice. Okay, why there will be a prolonged jaundice? That is because of hypothyroidism. There the conjugation is not happening properly. Okay, and that is the reason why you will have prolonged jaundice, and the patient will also have hypotonia and dry skin. Okay, now if the patient has all these, if the neonate is having constipation and delayed passage of meconium, and it is associated with all these findings, also the age of presentation is important here, because maternal thyroxine T4 hormone will be present in the neonate for a certain period of time, and it will gradually wane off, and that's when the patient will actually start presenting with these symptoms. So it wanes off within few weeks, for example 21 days. So that is when the patient will actually start presenting symptoms. So you can so that is also another clue for you to think about congenital hypothyroidism. Your first best step in management would be evaluating the levels of TSH and T4. TSH will be increased and T4 will be decreased, and newborn screening is also done for it as these days. Okay, now the next differential was cystic fibrosis. In case of cystic fibrosis, we very well know that there's something known as meconium ileus. Okay, and that is pretty much the giveaway for the disease, and there's poor weight gain, and there's also jaundice. So the first choice of diagnostic test would be the sweat test, and the patient will not have any other symptoms which were mentioned in case of hypothyroidism. In case of Hirschsprung disease, the patient will present with constipation, but in addition, there will also be a severe abdominal distension and bilious emesis. Okay, and on examination, the rectal tone will be abnormal. Now, you need to take in order that in case of cystic fibrosis, also there will be symptoms of intestinal obstruction, but the rectal tone will be normal. Okay, and for diagnosis for Hirschsprung disease, you can do abdominal x-ray, and rectal suction biopsy is the diagnostic test for Hirschsprung disease.